Hi, friends. Welcome to Tuesday Talk with BIM Group on a Thursday, recorded. Typically, we do this live every other Tuesday in our private Facebook group. I had to bump this week's to Thursday, and then we had technical issues. Not quite sure what was going on, but I'm happy I can record today's message and share it with you on our Facebook page as well as our website. So, with that being said, let me reset and get started. We have a lot to cover. I'm going to try to keep it to 20 minutes, but I think it's really important information that you need. And I'm going to apologize in advance if my dogs bark. They have been crated all day and I had to let them out. So I'm hoping that they behave themselves for the next 20 minutes. So at the onset, welcome to Tuesday Talk with BIM Group. I'm Deanna Sizemore, the Compliance Director with BIM, and I'm happy to meet here every other Tuesday, on occasion Thursday, and bring you the latest information in compliance in the benefits world. Last week, a rather large package passed, and everyone knows it as the stimulus bill. It's the American Rescue Plan Act of 2021. It passed on March the 11th, and it included not only the third stimulus payment, but a lot of moving parts and pieces that impact benefits, employers, unemployment, tax credits, FFCRA leave, and more. So today we're going to focus on two pieces. We're going to focus on the COBRA subsidies as well as the FFCRA, which is the Families First Recovery Care Act, optional extended leave that is now available. And then if there's time, I'll hit a high points on a couple of the items that I think are just noteworthy. At the end of this will be reposted on Facebook as well as our website, along with collateral that you can read more in depth if you really can't sleep at night and you want to confuse yourself. We'll put some information out there. Feel free to read through it. It's a lot of information, so take it in chunks and then give me a call or shoot me an email if you've got questions. I'm always available to our clients as well as our staff. And if you need anything and I don't know the answer, I will find out how to get the answer. So the American Rescue Plan has a piece in legislation in it called COBRA subsidies. And what it's saying is that eligible individuals will get COBRA 100% free from April 1 of 2021 through September 30th of 2021. How is it free, you say? Well, the employer is responsible for paying the COBRA subsidy premium or the COBRA premium. So the subsidy is provided by the employer. The employer can in turn take a credit on their Medicare payroll tax in the amount of the premiums that were paid. And if they pay more in premiums than they're due in taxes, it'll be processed as a refund overpayment. So if we take a step back to last year when the CARES Act passed, there was legislation in that said COBRA qualifying event, COBRA premiums, COBRA election notices, HIPAA special enrollment rights are all put on hold until 60 days after the end of the national pandemic is announced. So for the past year, we've been leaning into that. Well, you can't make somebody elect COBRA. You can't make them pay the premiums. You can't force a special enrollment event if it's outside the guidelines, the normal guidelines. And we've just been chugging along. Well, the national pandemic was supposed to end February 28th of this year. It did not end. It is still in effect. However, on February 27th, the DOL issued guidance on this holding period and what it really means. And I want to preface this part before I talk about the COBRA subsidies, because you're going to need to understand we've got a couple of conflicting dates and times and how things are going to work. And it's going to be real interesting to see how it plays out. So with that being said, if you do COBRA internally, I implore you to get a COBRA administrator. This is a great time to hand that off to the experts. There's new notices that are required. There's timing of those notices that's required. Your BIM Group account manager, account executive can get you a quote for COBRA services, and I think it'll be well worth the time spent versus the headache and stress that you'll have trying to meet all these requirements. So keep that in mind. So with COBRA and the CARES Act, all things were on hold. The DOL guidance clarification that was issued in February, the day before the pandemic was supposed to end, states that what they really meant was it's a 1-year hold or a 1-year moratorium. And that's based on each individual's qualifying event date, whether that was qualifying event to elect COBRA, payment due on COBRA, initial notice to be sent on COBRA, special enrollment rights, appeals and claims procedures, or appeals and claims on a claim, follow those procedures. All of those things have been on hold, and the new information says that hold is not indefinite. It is based on 1 year from that date that person's eligible for that event. So, for example, someone who had a COBRA qualifying event on May 1st, and let's say the employer sent the notice out timely, that beneficiary under prior CARES Act said they had until 60 days after the end of the national pandemic to elect COBRA. Then they had time to pay that COBRA premium. And as long as they paid that COBRA premium retro to May 1st, claims would be paid and they would be good to go. The guidance from the DOL says, okay, it's not till the end of the pandemic. It's to the earlier of the end of the national pandemic, 60 days, or 1 year from that person's qualifying event date. So granted, the pandemic doesn't end before May 1st. Our beneficiary from last year would be eligible through May 1st of 2021. And then the regular COBRA timeframe, 30, 60 days, to respond to elect COBRA and pay their COBRA premium retro to May 1st of 2020 and get coverage. What the American Rescue Plan Act does, it says that same person can decide they want to elect COBRA April 1st of 2021. They do not have to pay their retro premium. They'll get 100% subsidized COBRA coverage between April and September 30th, unless they have a qualifying event that would end before then. They don't have to pay the retro premiums, but they also don't have retroactive coverage. So the coverage, instead of starting May 1 of 2020, would actually start April 1 of 2021. The American Rescue Plan does not extend the maximum time length of COBRA. So if they were eligible for 18 months, they're still eligible for 18 months. And that 18 months began May of last year. So the eligible person that could get this COBRA subsidy and make this type of election was involuntarily terminated or had a reduction in hours that caused them to lose coverage. They are not covered by another group health plan, and they are not on Medicare. If those things line up, then that person is eligible for 100% COBRA subsidy for medical, and it appears dental and vision, and it applies not just to single coverage, but to dependent coverage as well. FSA COBRA premiums is not part of the subsidy, and I say that because there's things in the act that will talk about the FSA, and I don't want to confuse those two issues. So it's actually in the Consolidated Appropriations Act. The employee, or beneficiary rather, is responsible for telling the employer whether or not they have other coverage. So if they fail to notify you that they have other coverage, they will pay a $250 penalty or up to 110% of the premium assistance due after they were no longer eligible for a fraudulent failure to notify. So that's something to keep in mind. The subsidy is available until the first to occur happens, and that first to occur would be the September 30th date, or the date they become eligible for a group health plan, the date they become eligible for Medicare, or the date that their maximum COBRA duration ends. So you could have someone theoretically that was eligible November of 2019. They were laid off in November for whatever reason. They're technically eligible for this COBRA subsidy if they didn't elect. The COBRA premium or the COBRA subsidy would only be available for April, because April would be their 18th month of coverage. And so it would only be available for 1 month. So just keep that in mind. Again, there's a lot of dates, a lot of timing in there that you need to think of. With that, plan administrators are required to notify eligible individuals that the COBRA subsidy is available. And that's supposed to be done within 60 days of April 1st of this year. We are waiting for model notices from the DOL. Those are expected to come out. Plan administrators can allow current enrolled individuals to select new plans. The only difference is the premium can't be more than it is now. So if they had a high deductible plan now that was $200 a month and they want to switch to the PPO plan that's $600 a month, they couldn't do that. However, they could go from the PPO plan that's $600 a month to the HDHP plan, which is $200 a month. So the premium for the different coverage cannot exceed the premium for the current coverage that they're in. The different coverage in which the person enrolls is offered to all similarly situated active employees, and it's not consisting of accepted benefits such as dental, vision, or QSERA, HRA, that sort of thing. Look for more guidance. There's more to come on that. I think you just need to be prepared to issue notices. Confirm who you're with your COBRA vendors, that they're prepared to assist with the notices. I know that we've spoken with BMS, McGregor, Chart Snyder, ERS. They're all on top of this, ready to go, waiting for model notices to come out. As I said earlier, the reimbursement of the subsidy is through a credit against the Medicare payroll tax. And if your credit exceeds the payable tax amount, the excess is treated as a refundable overpayment. So more to come on that. The next question would be, or the next piece of that are the model notices. So there's going to be a new general notice and a notice of subsidy availability, a notice of extended election period, a notice of subsidy expiration. So think in terms of the current COBRA notices that we have now. You've got a COBRA initial notice. You've got a COBRA availability notice. You have a COBRA unavailability notice. You have a COBRA termination notice. You have the grace period notice. You have, COBRA's ending notice. All of those notices, plus now notices for the subsidy, are added on top of that. Again, if you're doing COBRA in-house, please take a look at having a COBRA vendor. It will save you time and effort in managing these new regs that we've got out. So I mentioned how the third parties that we're working with are handling this. The second piece of the American Rescue Plan was an expansion on the FFCRA employer paid sick leave and emergency family medical leave. So originally, under the FFCRA, the paid leave and paid family leave, expired December 31st. The Consolidated Appropriations Act extended that through March 31st as an optional. Employers could, if they wanted to, continue to offer employer paid sick leave and employer paid family leave and continue to take tax credits for those payments if they wanted to. That was, again, set to expire March 30th. The American Rescue Plan Act extended that again through September 30th. So again, it's optional. Employers, you have the option to continue offering employee paid sick leave and employer paid family medical leave as an option. If you do continue to offer it beyond April 1st, there are some changes you need to be aware of. On the employer paid sick leave, the dollar amount of payment is the same. If it's the employee out for his own illness, it's at the regular rate of pay. If they're out for another illness, it's 2/3 the rate of pay. What's different is the 10 days of paid sick leave resets April 1st. So I know when we got to the end of December, some employers that carried it on through March were like, well, what if they're out of sick leave? If they've used their 10 days? Well, there's nothing you can do about that. If you go and offer it continuing past April 1st, sick leave days reset at 10. So you've got that to look forward to. If you choose to continue that and continue to offer the family medical leave, again, set to expire 12/31. Consolidated Appropriations Act extended that through March 31st, and the American Rescue Plan extended that through September 30th. It is optional. The difference here is previously the maximum covered wages was $10,000. As of April 1st, it will be $12,000. Any leave taken on or after April 1st is not subject to that 10-day elimination period. So FFCRA, prior to 12/31, in order to take the paid family leave, they had to take the 10-day sick leave in front of that, and then the paid family leave. As of April 1st of this year, they don't have to worry about the 10 days. They can just go right on FMLA. So let's say they've exhausted their sick leave and they are still sick and they need to be out. They can jump right into paid family leave. If you've maxed them out at $10,000, they've got another couple of $1,000s you can make payment towards. The leave has also been expanded to include any paid sick leave reason there could be. Anything related to COVID, subject to federal, local, state quarantine, has a COVID symptom or symptoms, has a COVID diagnosis, caring for someone who has the same, or subject to quarantine, caring for a child if the school or daycare center is closed due to COVID, closed because of weather is not a reason, or is experiencing any other type of condition related to COVID. Also for COVID vaccine or vaccine symptoms or vaccine illness. Just keep that in mind. This is optional. It is optional in 2021. I just mentioned the COVID vaccination and sickness from the COVID vaccination. That is a new trigger for paid sick leave and family leave. So as an employer, your action items are to decide what you need to do. Do you want to continue to offer the paid leave and the paid family leave, or are you done with it as of either 12/31 or March 31st? Among that American Rescue Plan Act, there's provisions for employer retention credit, child tax credits, earned income tax credits. Unemployment was expanded. So there's some nuggets in there for HR professionals that you may want to be aware of that has come out of it. But at the end of the day, the big things that you need to work on right now or remember are the COBRA subsidies and deciding if you want to continue to offer the paid family leave, paid sick leave. So I'm going to leave it there. And I wish this was live so I could take questions. But if you do have questions, please email me at deanna@bimgroup.us or give me a call, 255-9455, extension 123. Or if you're watching this on Facebook, feel free to drop questions below in the comments. I'll try to get to those. And I think we'll have a Tuesday talk next week just to kind of talk through this a little bit more, as dig into some questions, maybe get a little more deep into the subject. But I'm just the messenger, and I hope this helps. I hope you have a wonderful afternoon, and I look forward to seeing everyone next week.